Hello, future leaders and lifelong learners. Are you ready to dive into the heart of Walsh University and the ever-evolving world of higher education? I'm Teresa Fox, and you're tuned in to Cav Chats. Here, we're not just talking, we're connecting you to the pulse of our campus and the headlines shaping universities everywhere. Think of Cav Chats as your backstage pass to the stories, the debates, and the innovations that matter to you most, right here at Walsh University and beyond. So whether you're a student, faculty, coach, administrator, or just passionate about higher ed, buckle up. You don't want to miss this. So let's get chatting. Hello, Cav Nation and beyond. Welcome to Cav Chats on this beautiful September day. I am beyond thrilled to be speaking with someone that has an extraordinary and diverse background, who happens to be our new dean of our newly established College of Health Sciences. Health Sciences, of course, at Walsh University is one of our most distinguished core competencies, so I'm very excited to talk to you and talk about it. Dr. Kim Cleveland, welcome. You're a nurse. You're an educator, you're a health policy leader and advocate. You just have such a rich background, and I'd love for you to share with our listeners just a bit about your career journey. It's been extraordinary.
Thank you, Teresa, and good morning, everyone. It is a thrilling opportunity to be here, and certainly I am thrilled to be at Walsh. I feel like my entire career has prepared me for being here. I started as a nurse, graduated from Ursuline College, and got to see how important it was to start building teams at the patient side up. That was an absolutely wonderful experience. Went on to become a clinical nurse specialist and a nurse practitioner specializing in cardiothoracic surgery and in the cardiothoracic ICU. And we found at that time that patients needed a certain level of advocacy if they were chronically critically ill. And what that meant was a place to heal that would help them heal their entire person, turn off all those iatrogenic things that happen in the hospital. So I was asked to find a place for our most complex patients, and that was the long-term acute care hospital. After that experience, I got a great idea of what it was like to advocate beyond the bedside and beyond the hospital walls, and that's what led me to my law degree. So after completing that, advocacy took a whole nother light for me, and I was able to use that with getting to become a lawyer. I practiced as a trial attorney for a while and went back into administration. And after I was there for a while, it was time for me to stop traveling nationally, and I came back home and started teaching. And there I learned that if I wanted to make an impact, I had to get my PhD. So I got the opportunity to go back again. And there I got to put together a whole lot of opportunity for nurses and nursing students to see how their voice in advocacy actually impacted patient outcomes. So I was coordinating for healthcare policy at Kent State University and able to impact students in nursing as well as in all of the other disciplines that we interface with. And from there, I ended up here at Walsh.
That's amazing. What a variety. It's just incredible the path that you took. What sort of inspired you to be drawn to higher education?
You know, it's amazing when you see the interface of what you learn at the patient's side. So you get some ideas of what's important to make sure everyone knows. But then when you see the back end of that, when something maybe didn't go right or you wish it would have went better, and what that means in terms of patient outcomes and community outcomes, it really helps you get focused a little bit more on, there's a little bit more that we need to know when we're preparing healthcare professionals. Part of that is really understanding systems. Part of that is understanding communication. But a really big part of that is understanding the importance of culture and how we build a culture of excellence from the bedside up.
And then you stumble on a little old Catholic university here in Northeast Ohio, Walsh University. So what drew you to Walsh?
It's my faith. I have been a practicing Catholic my entire life. I was blessed with a family that, instilled that faith in me. And certainly I started my college education there at Ursuline. So coming back here was just like being home. And, Walsh is in my backyard. So this was a great place to be.
That's wonderful. That's wonderful. So, talking about the College of Health Sciences for a little bit, this is a new college for us. It brings together nursing, counseling, exercise science, physical therapy, occupational therapy, and others. So what is the advantage of having that all under one umbrella?
You know what? We are so cutting edge with this, and I think it's amazing. The advantage there is really the fact that we get to work together just like we would be at a patient side or in the community, solving the problems that are pertinent and relevant to our community at the time. And sometimes we get focused on what our clinical expertise is, and we forget that there's this whole other piece that goes along with it. There's a financial impact, there's an advocacy impact, there's a professional development impact. When we bring every profession together to learn together and to analyze how we're learning together, we're able to create an education that's distinctive and very much in the best interest of our patients and our community.
So it sounds like there's sort of an interdisciplinary aspect to it.
Oh, this is very much interdisciplinary, and I would say interdisciplinary as well as intradisciplinary, because what we're doing is we begin blending how we approach patients and how we approach community assessment so that we're actually able to develop a product that's much different than any one discipline could do on its own.
That's great. So in your view, why is it the right time for Walsh right now to be establishing the College of Health Sciences?
Well, healthcare has been going through so many changes. And if there's one thing we've learned by our economic changes, by our policy challenges, by our interdisciplinary communications, it's that we have to work together to solve the problem. No one set of eyes is going to be able to solve the problems that we're facing. Some of those things are coming naturally because we're evolving with technology. We've all heard about AI and the impact it's having in healthcare, but we've also been dealing with the financial considerations that go along with providing communities with the resources to have the best health possible. So bringing everyone together now is just the right time to make sure that we have a voice in shaping what the future holds.
So what excites you most about stepping into this role, this opportunity that you have to bridge all of these disciplines?
Well, I think the thing that's most exciting is our students. It has been amazing to be with them on campus over the last couple of weeks. But when I look at that enthusiasm and that excitement, and I see that we're able to be that voice to help shape what they're going to do next in their career, that's what excites me. We're giving them real-world experiences in the community they live in the community that they've chosen to stay in. That's important.
So we're in sort of the mecca of the healthcare world right here in Northeast Ohio. We're surrounded by wonderful resources, wonderful healthcare resources, wonderful institutions of higher education. So tell our listeners what makes the Walsh University Health Sciences program unique.
It is our focus on the value of community and faith and bringing together how we deliver care. Because certainly we can't do this alone and in a vacuum. We have to do this working with everyone within our community. That doesn't just include everything that we have to offer or they have to offer. It also includes what their needs are and what opportunities they give us to solve those unique issues that are facing us right here in Canton, Ohio.
That's great. So how do we do that? How do we begin to build that community?
A lot of that we've already started here at Walsh. Certainly, we are aware of some of the issues that are going along with professional development, managing hunger and food insecurity, helping individuals gain access into higher education when they haven't had anyone else in their family who has gone into college or to have a career in healthcare. All those things are pieces that have been a part of our culture and natural. Bringing them all together and expanding them out to our community as a part of our family is what's making us different.
And I've heard that. I've heard that about Walsh graduates, that they go beyond just the practical approach of administering to patients, that they're just so much more well-rounded than that, and it's that holistic approach.
I think you're right. It's because our students see the entire person. From the moment they have that first interaction with a patient, they've already been prepared, or not with a patient necessarily, with a research topic. They've already been prepared to be able to address all of the pieces that make that project special, all of the components of the human condition that are going to give us the outcomes that we're hoping for.
So what would you say, Dr. Cleveland, is your leadership philosophy to lead the school, lead the faculty and staff, keep everyone inspired and moving in the right direction?
Well, I'm very much a transformational leader, but if I had to find that one anchor, it's really that concept of community engagement. We've got that culture here, and it extends so naturally into building the College of Health Sciences by making sure that we're working with our community hand in hand and constantly reassessing where we fit in and what needs are facing us so that we can help resolve the challenges. We are right there to help our community continue to grow and stay healthy.
So you oversee the Bayer School of Nursing, a critical flagship program here at Walsh. What is the status of nurses in Northeast Ohio? Is there a need still?
Oh, there's a tremendous need for nurses. But I have to say that there's also a tremendous need for nurse educators. And one of the things that I see us being able to contribute to is growing that body of nurse educators. The nurse educator need is a national need. We see that across the country, and it is very much a part of what we're going to need to continue to keep our eye on here in Canton as well.
Wonderful. So you mentioned the interdisciplinary approach. How do you see the different programs complementing each other?
I think each program takes a view of the human condition just a little bit differently. And as we get that 360 view, as we hear from some of our researchers in psychology and sociology, our counselors, as they start to see some of the research that's been established to draw on to give the best care that we can, our nurses who bring together all of those caring components from PT, OT, counseling, and also borrow from the research that we've established in psychology and sociology and the heart sciences, we're able to approach those patient challenges with a very unique and centered arrangement that not everybody gets a chance to do in their undergraduate or graduate student experience.
So first impressions, students, maybe recent graduates, what do you think about our Walsh University Health Science graduates?
Oh my goodness, they're amazing people. And you know, it's each one of their individual stories that makes this different. I was so thrilled as my door opened up and the students started coming in on the first day of classes. Our students are bold. They were happy to come in and say hi. They were happy to grab that Reese peanut butter cup or protein bar and be on their way to the next class. They are very, very unique. Each one of them, whether it's because of their contribution in sports, their contribution in the arts. We have some beautiful voices in the College of Health Sciences as well. So it could be any one of those number of things. They bring that entirety of their person to be able to impact the entirety of the people that they're teaching or the people that they're treating.
Sure. And it's pretty rigorous. I know we have adult learners, people with full-time jobs, people with families, even traditional students who are in sports. As you know, many of our Walsh University students are involved in athletics. So what sort of support or wraparound services do we offer these students?
We have a tremendous center for counseling for our students. We have a tremendous support for tutoring for our students. But the thing I like the most is how each of our advisors interacts uniquely and one-on-one with our students. And they know our students, and our students know them. When that connection happens in the hallway and you see the smiles, or you see the hug, or the swords up when we're dealing with some of the challenges, we know that there's a connection there that goes beyond a textbook. That's a human connection that's going to make a big difference when that student graduates.
I remember I was speaking recently with a graduate of our adult program here at the university, and I said, "Why did you pick Walsh over Akron?" He transferred to Walsh from Akron, and he said, at Akron, he said, at Walsh, I was able to call my advisor when I had a problem, and she helped me through it. And that would have never happened at Akron. I would have just been lost in a sea and waiting on a phone for somebody to get back to me. But just those services that support the fact that she knew her name, that was the reason why he chose Walsh and stayed at Walsh. So I think that goes a long way. So, you talked a bit about technology. I'm going to mention AI. I know it's just sort of the driving factor of a lot of the curriculum these days. But how are you going to embrace or integrate technology into the approach with the college?
We really are building that into all of our classrooms and at each level. I think the one thing is you can't wait and build technology in year 3 when you've gone through 2 years of not seeing it. So AI, for example, gives us the opportunity to work with students on issues like intellectual property, making sure that you understand when you're writing an essay what all of that means, whose intellectual property it was, where it came from. On the diagnostic end, understanding the limitations of AI, that you really need to be human driven in order to make AI work in the healthcare environment. And helping to define where those parameters are is probably one of the most important things that we can do as educators in the health sciences right now.
It's wonderful. So looking ahead 5 years as Dean of College of Health Sciences, what is your measure of success? What does success look like for you?
I think my measure of success would be that every person in our community here had a firsthand experience with one of our graduates, whether that's a graduate in PT, OT, nursing, counseling, whether it's a researcher in sociology, psychology, or a counselor. We have such a unique product that if we can touch each member of our community and Walsh can touch them every single day, that's going to be my measure of success.
That's wonderful.
And of course, we want to make sure that all those programs are growing, because the more we grow, the more we can impact the next generation. And that just becomes that perpetual excitement of constantly growing with our community.
And our students are very much out there in the community. They have clinicals, correct? Do we help with that?
Yes, we do. We help with placement for our clinicals, and that's a wonderful thing for students because that doesn't always happen. But we do that at Walsh. And our alum are very instrumental in helping our current students get the support they need to find some of those clinical placements.
So what advice would you give a prospective student, an adult learner perhaps, that's maybe thinking of switching careers or entering a health science field? There's a lot of mixed opinions right now about that with the changes in the healthcare industry. So what advice would you give?
Well, I'll tell you what, I'm a first-generation college graduate. And one of the things I learned from my grandmother, who was from Czechoslovakia, was that sometimes you just have to shed the fear. And she would always say, just do it. So if this is something where you see yourself being able to make an impact because you're driven by a compassion-rich profession, if you feel that you want to marry the hard sciences with the compassion it takes to take care of someone on a day-to-day basis, if you're excited about writing and you're excited about merging the hard sciences with all of the social sciences, don't be afraid. Just do it. We have the support for you here. And I think this is where you find your home and you find a whole set of people who are going to be here to support you no matter what you need.
And how about for our community partners out there who may be listening? What would you say to them?
Thank you. We need you. We are looking forward to seeing you in our advisory committee. And if you have great ideas, you're welcome to my cell phone anytime you'd like it.
Uh-oh, I won't read it out. I won't read it out now, but we'll keep that in mind. That's wonderful. Well, Dr. Cleveland, it's just been such a pleasure talking with you, and I wish you much, much success. I can't wait to see how this unfolds over the next year and beyond. And certainly if anyone is interested in one of our many fields in the health sciences, please don't hesitate to outreach Dr. Cleveland on our website. So thank you much, and have a wonderful day, everyone. Take care. Until next time.
Thank you.
Signing off.